Welcome to Bloom and Beyond, where we dive deep into the realities of midlife, menopause, and everything in between. This is the third episode in a three-part series examining menopause symptoms that often go unnoticed or get misdiagnosed. Because let's be honest, there's a lot more to menopause than most people know. This episode is titled, The Unexpected Symptoms of Menopause, What No One Told Us. I'll share my disclaimer first. The information shared in this podcast is for informational purposes only. It is not intended as medical advice, diagnosis, or treatment. Always consult with your healthcare provider before making any changes to your diet, exercise, or medical care, especially if you have an existing health condition. The views expressed here are my personal experiences and research, but individual health needs may vary. So first, I'd like to share some of my personal experiences that completely caught me off guard, and maybe you can relate. The first one is hip pain and stiffness. The one thing I noticed first about hip pain was that almost every time I got up after sitting for a while, I felt stiff and sore, sometimes even limping for a few steps before I could walk normally. And at night, my hips ached so badly that falling asleep was a struggle. I would be lying in bed and my hips would just be throbbing. At first, I chalked it up to aging, and then I thought maybe it was due to all the running that I used to do. But it turns out that joint pain, especially in the hips, knees, and lower back, is a common symptom of menopause. I had no idea. Why does this happen? Estrogen plays a role in reducing inflammation and maintaining joint health. As estrogen declines, inflammation increases, leading to aches, stiffness, and even conditions like osteoarthritis. So what helps with this? Gentle movement throughout the day, staying hydrated, strength training, omega-3s, and anti-inflammatory foods like berries, leafy greens, and turmeric can make a difference. The next issue that I continue to deal with is menopausal acne. I thought I had left this behind in my teens. My face was breaking out worse than it ever did when I was a teenager. I initially thought it was due to mask wearing during COVID, because that's when I really noticed it, but nope, it was my hormones. After I stopped wearing masks, I figured it would go away, but it actually got worse. Menopausal acne is real, and it happens because estrogen levels drop while testosterone remains steady or even increases. This shift can cause oil production to spike, leading to breakouts, especially around the jawline, chin, and cheeks. I was miserable. So what helps? A simple, gentle skincare routine, but avoid harsh exfoliants. Balancing your blood sugar, and sometimes medication like doxycycline, which I'm taking now, can keep breakouts in check. All of these have helped me. If this sounds familiar, don't be afraid to see a dermatologist. These two symptoms were ones I didn't expect, and they were serious and they were bothersome for me personally. Other unexpected menopause symptoms that you might not realize are hormone-related are the following. Burning mouth syndrome, a tingling, burning, or numb sensation in the mouth, which is often due to declining estrogen affecting saliva production. Electric shock sensations, a sudden zap feeling in the head or body. This is thought to be linked to fluctuating estrogen affecting the nervous system. Ringing in the ears. Hormonal changes can affect the tiny blood vessels in the inner ear, causing ringing, buzzing, or even a feeling of fullness. Itchy, crawly skin. Some women feel like bugs are crawling on them or they have intense itching, and this happens because estrogen helps with collagen production and moisture retention. When it drops, skin can feel dry and irritated. Burning feet and hands. A sensation of heat in the extremities, often connected to circulation changes during menopause. Heart palpitations. Many women report their heart skipping beats or racing unexpectedly. While scary, this can be due to estrogen impact on heart function. However, always check with a doctor to rule out anything that might be more serious or any other causes. Body odor changes. Some women notice they sweat more or that their body odor smells different. Hormonal shifts affect the types of bacteria on our skin, which can lead to changes in smell. sudden food sensitivities. If you've never had issues with dairy, gluten, or other foods, but then you suddenly feel bloated or nauseous after eating them, menopause might be to blame. The gut microbiome changes as estrogen drops. And then there's increased anxiety or panic attacks. Even if you've never dealt with anxiety before, menopause can trigger it. Estrogen influences serotonin and cortisol, so when it drops, mood swings, heightened anxiety, or even panic attacks can appear out of nowhere. Gum issues and dry mouth. Hormones affect the health of your gums, leading to more sensitivity, bleeding, or even receding gums. So visit your dentist. So what can we do? Menopause isn't just about managing symptoms, it's about understanding our bodies on a deeper level. If you're experiencing any of these unexpected symptoms, know that you're not alone. Here are a few things that might help. Stay active. Movement helps with joint pain, circulation, and even mood swings. Support your skin and joints. Hydration, collagen, and omega-3s can help. Reduce inflammation. A diet rich in whole, unprocessed foods can minimize symptoms. And check your hormone levels. If your symptoms are severe, a healthcare provider can help with testing and possible hormone therapy options if you're so inclined. And build your community. Talking to other women going through the same thing can be empowering and reassuring. So, final thoughts. Menopause is a transition and not a disease, but that doesn't mean it's easy. The more we talk about it, the more we can advocate for ourselves and support each other. And if you're looking for more resources, join me in my upcoming menopause course, where we dive deep into these topics and more. Let's navigate this journey together. Until next time, stay strong, stay informed, and keep blooming.